we'll provide that information as well.
Okay, thank you. We go now to Mr. Davies. 6 minutes, please.
Thank you, Mr. Chair, and I'd like to take this opportunity on behalf of the New Democratic Party of Canada to thank all those Canadians, healthcare workers, transport workers, cleaners, allied health workers, everybody who is working through and helping to keep us all safe. I think I speak for all parliamentarians when we say how important your work is and what a debt Canadians owe to you. I'm going to ask my first question to Health Canada, to Mr. Lucas. On March 9th, Deputy Prime Minister Freeland wrote to the provincial and territorial premiers asking them to inform the federal government of any critical gaps in supplies or their capacity to deal with the COVID-19 pandemic. Things like ventilators, N95 masks, testing reagents, equipment, face shields, etc. I'd like to know what were the major gaps identified to the federal government, and if you can give us an approximation of the size of those gaps, please.
Mr. Lucas, go ahead, please.
Thank you, Mr. Chair. We have had an ongoing process supported through the Public Health Agency of Canada to understand the needs of provinces and territories and to contribute to the bulk purchases the Government of Canada is doing on behalf of them. And certainly President Namişniowski can speak to that further. So the information provided through the letters incoming that you referred to reinforced areas that provinces were seeking additional support from N95 masks and ventilators, and we have moved proactively to order those from all available suppliers, as well as noted through comments made already to work with Canadian businesses, either with existing production or areas where they can create new production to address those needs. We are monitoring this on a day-to-day basis and in constant dialogue on a daily basis with provinces and territories to understand those needs and work to address them. In addition, provinces and territories provided information on other areas of focus, including support for Canadians, unemployed workers, and businesses, and those have been addressed through measures announced to date and work underway. I'll turn now, Mr. Chair, to President Namişniowski for any further comments.
Okay, thank you. Mr. Davies, would you carry on?
Yes, please. If I could ask the witnesses, I'd like to direct my questions to the witnesses I'd like to answer, please. We have very limited time. I'm disappointed in your answer, Mr. Lucas. I asked you a very specific question of what the provinces told you their gaps were and what the extent of those gaps are, and I think Canadians have a right to know that information. I'm going to turn to something else. On March 27th, in the Globe and Mail, Dr. David Naylor, professor of medicine at the University of Toronto, wrote the following. He said, however, we could be far better informed. Our rate of testing has accelerated, but the coverage is still well below that needed to give an accurate picture of the epidemic. Thousands of test results have been backlogged at various times, leading to intermittent and confusing spikes in case counts, even as tardy delivery of provincial case reports to the Public Health Agency of Canada has blurred our view of national outbreak demographics. This was written 4 days ago. To the Public Health Agency of Canada, is Dr. Naylor, is that an accurate assessment by Dr. Naylor?
Ms. Namişniowski, please go ahead if you wish.
Mr. Chair, can you hear me?
Yes.
Okay.
The interpreter regrets, but the individual sound quality does not permit interpretation.
Ms. Namişniowski, I think the interpreter is having a problem with your line, I believe. Make sure you're speaking loudly and clearly. Try again.
Okay, Mr. Chairman. Is this better?
The interpreter indicates that the sound quality seems insufficient. Is the phone in hands-free mode?
The interpreter asks, I don't know if you can hear that, but the interpreter is asking if the phone is in hands-free mode or if you're in speakerphone mode, please speak directly and not use speakerphone.
Mr. Chair, yep. I do have my phone in hands-free mode. I'm just afraid if I take it off that I'm going to hang.
The interpreter regrets, but hands-free mode is insufficient for interpretation purposes.
Mr. Chair,
this is Matt, the operator. Just to confirm, might as well put it remove from speakerphone. If ever it disconnects, just simply call back. We'll answer you right away because sound quality is very bad. Yep.
Hey, I'm going to hang up and call back.
Okay.
Okay.
Very well. We will suspend for a couple minutes while that happens.
Mr. Chair, this is the interpreter speaking. Can you hear me?
Yes, I can.
I do have a question for you about the line being used by Mr. Ozowski from the Border Services Agency. Could you confirm if his device was in hands-free mode? Because we were getting a lot of echo on our end.
Mr. Chair.
Yes?
So it's Tina Nemesianowski.
Yes?
I apologize. I have a phone that once it's on hands-free, I can't get it off unless I hang up. It's defective. So maybe I could try and respond to the question.
Okay, just before you do that, I have a question from the an interpreter regarding Mr. Ozowski. Is your phone on hands-free mode or not? If next time you speak, make sure that it's on not on speakerphone. Please go ahead, Ms. Nemesianowski, to respond to Mr. Davies' question.
Okay. So, Mr. Chair, in response to the question that is asked, federally we have been working with all of our provincial and territorial partners on the issue of testing within Canada. I think there is broad recognition of the importance of testing and the need to ramp up testing across the country. And there is a commitment that collectively there will be increasing numbers of tests that will be taken to enable us to have a fulsome picture of the state of COVID-19 within Canada. It's hard for me to speak to what may be happening within a particular jurisdiction in the sense that it is really a question better directed to a jurisdiction. But I can say that we have collective commitment to ramp up testing overall, and as we have every single day, increasing effort is being placed on testing and ramping up our overall approach across the country. But this is a question that also implicates my colleague at Health Canada. So he may wish to add more if the, Mr. Chair, if that's of interest to the committee.
Mr. David, you wish to hear from Mr. Lucas?
Well, I'd appreciate just directing the questions if I could. My next question then is Italian physicians, I think today actually, came out and said very clearly that putting COVID-19 patients in hospitals with other patients was one of the main causes of transmission and a leading contributor to excessive deaths. And we know that public health experts are suggesting that Canada can significantly decrease the risk of medical facilities becoming centres of amplification by setting up facilities dedicated only to COVID-19 patients. To Mr. Lucas, does the Government of Canada have plans in place to establish separate facilities for COVID-19 patients? And I would specifically ask for that in the context of delivering service to Indigenous communities in this country as well.
Go ahead. I'm sorry, Mr. Davis, to whom was that question directed?
To Mr. Lucas, please.
Mr. Lucas, please go ahead.
Thank you. As I had noted, we are working closely with the provinces and territories, given their work on managing their healthcare systems. A number of them have established COVID-specific parts of hospitals, as well as alternate facilities to allow patients to move out of those hospitals to focus efforts in the ICU on COVID patients. This is critical, as you noted, to ensure that the risk of infection from donning and doffing of protective equipment as healthcare workers move between wards is minimized to the greatest extent possible. Additional assets are being defined in terms of facilities to help support efforts as needed, including working through Indigenous Services Canada and the First Nations and Inuit Health Branch there to ensure the supports needed for Indigenous people. So